New fears tonight in the battle against Ebola. A nurse at a Texas hospital has tested positive for the deadly virus. Officials say it's the first known case of Ebola being contracted or transmitted in the U.S. TV 1055's Hazel Sanchez joins us with more. Hazel?
Cindy, the CDC is looking at every healthcare worker in Dallas who cared for the Ebola patient who died last week. One of his nurses contracted the deadly disease. Now the question remains, with all the precautions in place, how did she get infected?
The Centers for Disease Control say a nurse who had extensive contact with Ebola patient Thomas Duncan tested positive for the disease. Duncan died last week. The unidentified woman is the first patient to contract Ebola in the United States.
There was a breach in protocol, and that breach in protocol resulted in this infection.
It's not clear how the nurse was infected. CDC Director Dr. Thomas Frieden says she may have touched contaminated protective gear. Hospital officials in Dallas say healthcare workers should not be alarmed.
We're confident that the precautions we have in place right now are protecting our healthcare workers.
A national nurses group based in California says the same cannot be said for all healthcare workers. The group conducted a nationwide survey of nearly 2,000 nurses. 76% say their hospital has not communicated to them any policy on how to admit potential Ebola patients. 85% say their hospital hasn't provided their staff with interactive education on Ebola. And 37% say they don't have enough protective gear.
We are asking for that optimal protection, personal protective protection. And our hospitals, as you heard from the survey, are not providing the training that we need, nor are they providing the personal protection that we need to keep our patients, ourselves, our families, and our communities safe.
Hospitals are not alone in taking serious precautions. On Saturday, JFK Airport began mandatory screening of passengers arriving from West Africa, where the Ebola virus is widespread. People are required to be interviewed by the CDC and have their temperature taken with a no-touch thermometer. Today, Los Angeles International Airport crews quickly isolated a United Airlines plane from JFK after a passenger complained of having Ebola-like symptoms. Public health officials quickly determined the woman was not at risk for having the deadly disease.
We're also learning of another possible case of Ebola tonight in Boston. A man who had been to Liberia went to the hospital complaining of headaches and muscle aches. He is currently being evaluated at Beth Israel Deaconess Medical Center.